Okay, so we like to offer women the Peaches package. We've been using it for about 18 months now to help reduce our rates of trauma of women tearing during childbirth. So the Peaches is broken down into the P, which makes us we need to consider the position of the mum when she's having her baby. E is we ask for extra help in the room, in the labour room, or at home if we're doing a home birth. The A is to assess the perineum, so we're having a look all the time to make sure that the perineum's healthy, it's stretching, and there's no scars or anything that we might think that may tear. C is to communicate with the woman, so we want to make sure that our communication is very clear, so that the woman can listen to us and we will advise her and help her way through the birth. H is for hands-on, so as midwives we will support the perineum, so we'll have a hand on the perineum and a hand on the baby's head to help slow the delivery down. E is for episiotomy. That's not to say that every woman will have an episiotomy, but we will assess and see if we need to do an episiotomy. If we think that there's going to be a significant tear, it's better to do an episiotomy. And then the S is for slowly. So the best way to deliver the baby is very, very slowly. The slower the better. So always listen to the midwife when she's talking, the woman through with that bit, because that's probably the most important part, is being really slow. So after you've had the baby, the midwife will have a look at your perineum to see if you have any trauma. Depending on the severity of the tear will depend whether or not you would need stitches. Sometimes if you have quite a significant tear, you may need to go into theatre to have that repaired by one of the doctors. If you've had a significant 3rd or 4th degree tear, then you will be given antibiotics. And also make sure that you have adequate pain relief, and sometimes you may be given a laxative to help you go to the toilet. You will get a follow-up appointment with one of the consultants, one of the doctors, usually around about 6 weeks, and from then they will see how you're healing and if you need any further treatment or referral from then on.